Now, our present lecture will be on meningitis. We will discuss about the important etiology, laboratory diagnosis, and treatment. This lecture will be suitable for MBBS students and also for the postgraduate students of microbiology. Meningitis is the inflammation of meninges, that is the covering of the brain and spinal cord, that is pia mater, arachnoid mater, and dura mater. This is a devastating disease with a high mortality, about 50%, and overall mortality from bacterial meningitis in children varies from 20 to 30%. Every year, 171,000 deaths occur worldwide. Though all types of microbes, that is bacteria, virus, fungus, can cause meningitis, bacterial meningitis is of particular concern. Despite of increased access to potent and advanced antibiotics, it causes heavy death toll. Complications of the disease include blindness, hearing loss, neurological disorders, decreased consciousness, and paralysis. Though there are many causes of meningitis, especially the bacterial meningitis, according to WHO, 4 bacteria, that is Neisseria meningitidis, also known as meningococcus, Streptococcus pneumoniae, also known as pneumococcus, Haemophilus influenzae B, and Streptococcus agalacti or group B Streptococcus. They are responsible for more than 50% of deaths from meningitis, and they cause other severe disease like sepsis and pneumonia. So students must have to remember these 4 bacteria. They should not forget this: Neisseria meningitidis, Streptococcus pneumoniae, Haemophilus influenzae B, and Streptococcus group B, of which Haemophilus influenzae B nowadays these are less frequent because of vaccination. And in the neonatal age group, Escherichia coli and Listeria monocytogenes, another 2 important cause, along with Streptococcus group B. So for neonatal meningitis, 3 causes are important. Other causes of meningitis, this is the detailed causes: bacteria, parasites, fungi, and viruses. Just at a glance, all the important gram-negative bacteria like Klebsiella, Salmonella, Pseudomonas, Acinetobacter can cause meningitis. Streptococci, Staphylococci, Mycobacterium tuberculosis can cause chronic meningitis. Among the parasites, Naegleria fowleri, Acantha species, and among the fungi, Cryptococcus neoformans can cause meningitis. Among the viruses, enteroviruses are responsible for more than 85%. They are also known as picornavirus, polio, Coxsackie, echo, para-echo, and enterovirus 71. Among the herpes viruses, herpes simplex, herpes zoster, and Epstein-Barr virus, mumps, measles, influenza, and HIV can also cause meningitis. And some arboviruses may cause meningitis as a part of encephalitis and lymphocytic choriomeningitis. Bacterial etiology varies according to age group. Less than 1 month, group B, Escherichia coli, other gram-negatives, and Listeria plus these bacteria. 1 month to 50 years, classical the agents, and more than 50 years, the classical agents like Neisseria meningitis, Streptococcus pneumoniae, and Listeria monocytogenes. So total, you will have to remember these 6 bacteria: Streptococcus pneumoniae, meningitis, Haemophilus influenzae B, E. coli, group B, Streptococcus, and Listeria monocytogenes. Bacterial etiology also varies with some special conditions like post-basilar skull fracture, post-trauma recurrent meningitis, is post-traumatic or post-neurosurgical, then Staphylococcus epidermidis or cons or Q2 acne, previously known as Propionibacterium acne, they can cause, and Pseudomonas aeruginosa, diphtheroids, Candida species, Acinetobacter, this opportunistic pathogen they can cause in case of this catheter shunt related or post-traumatic or post-neurosurgical meningitis. Transmission route also varies by organism, but most important route is respiratory droplets or throat infection, throat secretion, because meningitis, most of the meningitis causing bacteria, they are carried in the human nose and throat. Group B Streptococcus is an exception. It can spread from mother to child around the time of the birth because they are the human vaginal tract carries these bacteria. Usually, the carriage of these organisms, the meningitis causes organism, usually harmless, rather helps to build the immunity against infection, but the bacteria occasionally invade the body, causing meningitis and sepsis. Signs and symptoms also varies with the age group. In adults, severe headache, neck rigidity, high fever, sometimes drowsy, confused, convulsion, joint pain, etc. In case of babies, different types of signs symptoms are there: poor feeding, sleepy, irritable, fever, neck rigidity, convulsion, vomiting, etc. A laboratory diagnosis is based on cytological, biochemical, bacteriological, immunological, as well as molecular biological test of CSF. And among the specimens, CSF is most ideal, but blood culture is useful, and other specimens include nasopharyngeal swab, pus, or scrapings from the rash if it is present. CSF collection, it is usually CSF is obtained by lumbar puncture following a strict aseptic procedure. It is collected in 3 sterile bottles. One is sent for bacteriological tests, another for biochemical, and third one for cytological test. Transport and processing, it is to be processed immediately because it is very precious specimen. There must not be any delay. If any delay, should be kept at 37 degrees centigrade or in the incubator, but never in refrigerator, because the meningitis causing bacteria, especially Staphylococcus pneumoniae, Haemophilus influenzae, Meningococcus, they die in the refrigerator. These are the CSF findings in different types of meningitis. In the bacterial meningitis is usually turbid. Protein content is high, glucose content is low, and CSF serum glucose serum ratio is less than 0.4, and the cells are, there is more than 500 to 5,000 cells per cubic millimeter, and predominant cells are neutrophils. And when gram staining performed, 60 to 90% cases, gram staining builds positive result according to the bacteria. Viral infection, glucose is usually normal, it is not turbid, and cell count is less than 1,000, and gram staining is negative, and predominant cells are lymphocytes. In case of fungal or TB, there is fibrin clot during after collection. Protein content slightly high, glucose is around normal, and the lymphocytes with only 100 to 500 count. Gram staining is negative, but Zn staining is positive. Other tests include bacterial antigen detection, culture, and the multiplex PCR for the virus and bacteria all. So all tests can be performed on CSF. And blood culture is also an important test. Treatment varies with the age groups and pediatrics. We will discuss only the adult and more than adult with comorbidity. In case of adult, 1 to 50 years, third generation cephalosporin IV double dose plus vancomycin to cover gram positive as well as gram negative organisms plus dexamethasone with or just before the first dose of antibiotic. And after getting the culture sensitivity result, the therapy will be according to the culture sensitivity result. But if the patient is more than 50 years, ampicillin IV to be added along with third generation cephalosporin and vancomycin and dexamethasone with or just before the first dose of antibiotic. Prevention by vaccination and prophylactic antibiotics. Vaccinations are available against meningococcus, Haemophilus influenzae B, and pneumococcus. And prophylactic antibiotics are indicated for close contacts with meningococcal patients. Ciprofloxacin is the antibiotic of choice, and ceftriaxone can also be used single dose. Regarding the prevention of neonatal meningitis by Streptococcus group B, universal screening for carriage of group B Streptococcus in pregnancy, and if any mothers are positive for group B Streptococcus, then intravenous penicillin during labor to prevent their babies developing group B Streptococcal meningitis. So thank you very much.